and I'm going to begin our recording. And if y'all are ready, we will start admitting our guests. Okay.
And I will start sharing the screen.
Okay. Hi, everybody. Welcome. Hi, everyone. Welcome. We're admitting you all in. We'll give you just a couple minutes to get everyone in. And there are a lot of us. This is great. And we'll get started in just 1 minute. All right. If y'all just want to keep an eye on admitting people, we'll go ahead and get started. Hi, everyone. I am Sam Cusimano from LSU Health Foundation. Today, welcome to Cutting Out Women's Cancer. We have all of your cameras turned off and audio turned off for security reasons, but we'd like for you to post all of your questions and comments in the chat feature to the bottom right of your Zoom screen. And we'll be taking time to answer all of your questions at the end of the talk, so please post them there. We'll be posting the websites for you to find out more information about the Gynecologic Oncology Department at LSU Health and how to support the program in our chat. So please see the chat and slide at the end for those URLs. This webinar will also be posted to the Foundation's social media channels and to our website. Those links will be posted in the chat feature as well. If you have any questions, you can message me or email me directly. And now I'd like to introduce Dr. Nair to kick us off.
Thank you so much, Sam, and thanks to all of you for being here. So today our division is going to talk to you about what we're trying to do to cut out women's cancer in Louisiana. Slide. So myself, Sam introduced me. I'm Nair. I'm one of the GYN oncologists here at LSU New Orleans, and I'm joined by my two partners, Dr. Amelia Jernigan and Dr. Tara Castellano. And the three of us will give you a little snapshot into the state of GYN cancers in Louisiana, and also what we are doing in our division to cut those out. And then following that, we actually have three of our gynecologic cancer survivors who are speaking about their personal stories. And this part I'm really excited about. So you'll get a real life snapshot into what it's like to go through these diseases, and they're not easy, let me tell you. So I'm really excited that they are being so brave and wonderful and sharing their very personal stories. So to start, gynecologic cancers are cancers of the female reproductive tract. So that includes cancers of the ovaries, fallopian tube, uterus, including the lining of the uterus, which is called endometrium, the cervix, which is the lower portion of the uterus, as well as the vagina, and the vulva, which is the outside portion. The symptoms can be vague and nonspecific, but there are some definite symptoms that require workup, and that includes abnormal vaginal bleeding. Specifically, postmenopausal bleeding is always abnormal, and that requires a visit to a gynecologist to be evaluated. Other symptoms can be less specific, like pelvic pain or pressure, sometimes just bloating, occasionally urinary frequency and or urgency, and vulva irritation or feeling like there's something that you can feel or see on the outside. The Centers for Disease Control has this really nice little symptom diary that is a great reference to, and I've posted the link there. If anyone is ever worried that they may be having something abnormal, they can keep track of it over a 2-week period and use that little 2-week diary to decide if they need a further evaluation by a gynecologist. The risk factors for gynecologic cancers in general include obesity, certain inherited cancer syndromes like BRCA or BRCA. Also, Lynch syndrome puts you at risk for certain gynecologic cancers, specifically ovarian and uterine cancers. Having chronic infection with HPV or the human papillomavirus puts you at risk for cervical, vulvar, and vaginal cancers. And things that we as women can do to protect ourselves from getting these cancers, the sort of easiest thing and one of the really great inventions of our lifetime is the HPV vaccination. So that can be protective against the number of HPV-related lower genital tract cancers. Getting your regular well woman exam, and for patients with complex cancer family histories, getting genetic counseling and testing if that's appropriate. Just to give a little snapshot into what gynecologic cancer treatment can entail, and a lot is very specific. It depends on the type of cancer, the stage of cancer, and what other parts are involved. But in general, it can include surgery, and some of these lovely women will speak to you about their experiences with surgery. It can include chemotherapy and or radiation therapy. For certain cancers, targeted therapies are options. And for all of our cancer patients, we always try to offer them clinical trials, and Dr. Jernigan will speak to you about why that's important and what we have here at LSU. So with that being said, I'm going to hand it off to Dr. Tara Castellano, who's one of our newest GYN oncologists here, and she's going to give you a little snapshot into cancer in Louisiana.
Thank you so much, Dr. Nair. My internet's a little stable, so bear with me. I'm Dr. Castellano. I'm going to talk to you a little bit about the state of cancer and cancer care in Louisiana, and how are we doing, not with GYN cancers alone, but with all cancers. The answer is there's a lot of room for improvement. As we see, in 2019, Louisiana ranked 44th in cancer-related deaths, and that translates to approximately 215 deaths per 100,000 patients. And then if we look at projections for 2020, we can see that there's an estimated 26,000 or greater cases in Louisiana for this year, and that translates to over 9,000 deaths. And for a small state, those numbers are pretty large. For GYN cancers in particular, in 2020, it's estimated that more than 1,200 patients will be diagnosed with a GYN cancer, and as Dr. Nair said, that's a cancer generally of the uterus, cervix, or ovary, or other vaginal and vulvar lower genital structures. When we look a little bit deeper at trends in GYN cancer, not just in Louisiana, but in the country, we find that while overall the incidence of cervical and ovarian cancer has been slightly decreasing over the years, it's really on the increase, and frustratingly so for many of us that treat that disease. So what can we do, and why does Louisiana have one of the highest cancer mortality rates in the nation? Well, it really all leads back to how we're taking care of patients before they get their cancer diagnosis or before the cancer even develops, and that really lends to achieving public health goals. For example, Louisiana unfortunately remains at the bottom of the pack for the prevalence of obesity, ranking 47th. Smoking, which we all know is a risk factor for cancer development, Louisiana also 43rd. And while HPV vaccination, which we know prevents cervical and vulvovaginal cancers, though we're not as bad as smoking and obesity, we're still at the bottom half of the states and getting vaccination rates up to par. The last thing that really can affect cancer outcome and cancer care is how much access do patients have to the specialists that treat their cancer. And for us in GYN oncology, that can really make a impact in how their cancer is treated, or if they get a diagnosis timely at an earlier stage where the poor outcomes are more preventable. So as you can see, not so long ago, just in our state, we only had a handful of GYN oncologists who are specially trained to treat GYN cancers. Now we still don't have that many, and the few that we do have, we have 9 are mostly concentrated in the metropolitan area. We have a total of 13 in the state, and the other 4 are really 2 in Baton Rouge, 1 on the North Shore, and 1 in Shreveport. So if you're living in Central or Southwest Louisiana, it will be harder to get experiencing those symptoms that is concerning for GYN cancer.
Thank you very much.
Jernigan talk about our division here and at LSU. Thank you.
Thank you, Dr. Castellano. That was great. It is my absolute pleasure to talk to you all today about the exciting things that we're doing here at the section of GYN Oncology in LSU New Orleans. And so our mission is to raise the bar for women's cancer care in South Louisiana using a 4-pronged approach of promoting evidence-based care, improving access to cutting-edge treatments, promoting education of the public, our patients, other providers, trainees, ourselves, and advocating for the women of the state who face a gynecologic cancer. In talking about what we're aiming to do, I think it's important to discuss where we're coming from. After the storm, the women of New Orleans in the general region really struggled with access to subspecialists. So leading up to 2016, there was one very dedicated GYN oncologist who worked with LSU, and he primarily practiced last at Interim LSU Hospital, and he was very beloved, but did retire shortly before I started. When I onboarded, there were actually fewer GYN oncologists in the state than there were at the hospital where I did my training and fellowship. Access to a gynecologic oncologist is a critical component of cancer care. And when discussing gynecologic cancer outcomes, GYN oncology care is linked to better outcomes and longer overall survival. So the very severe shortage of GYN oncologists in the state was a really big barrier. I saw a lot of really wonderful physicians trying their best to provide the best care possible, but without GYN oncologists available, women were really suffering. So I've been really lucky to work with a very practical and forward-thinking chair, Dr. Peacock, and the leadership at the LSU School of Medicine, who've been very, very supportive as we've tried to grow the division and improve women's cancer care. We were pretty easy to demonstrate the need, and through a strong partnership, especially with LCMC, we've been able to recruit and build a program that I think meets and even is exceeding and starting to take that need to the next level and be really progressive, forward-thinking, and advanced. We now have 3 fellowship-trained GYN oncologists, 1 physician's assistant who works with us at UMCNO, and a strong collaborative relationship with some tremendous colleagues throughout the state in medical oncology, radiation oncology, palliative medicine, obstetrics and gynecology, and beyond. Because of the support and vision of the leadership at LSU and LCMC, we've been able to build a really robust program that serves 5 hospitals at several different clinical sites. And we continue to look forward to hopes of bringing excellent women's cancer care to more rural and remote areas of the team. Next slide. All right. So this is some of our team, and I'm sure we're not going to be able to be as comprehensive as we'd like. I'm Dr. Jernigan. I am from Annapolis, Maryland, fell in love with New Orleans in college, went on to do my training in Philadelphia and then Johns Hopkins in Baltimore and then the Cleveland Clinic. I was really excited to have the opportunity to return to New Orleans. Dr. Nair joined me in 2018. She's a local. She did attend medical school at NYU and residency at Emory in Atlanta before attending fellowship at Mount Sinai in New York. She's extremely high standards and is a fierce patient advocate. She settles for nothing short of the absolute best when it comes to her patient's care. And I think she's really helped us not only do our work, but do it very well. Dr. Castellano is our newest addition and just joined last week. She is a local, attended med school here at LSU in New Orleans before residency at UNC Chapel Hill and fellowship at University of Oklahoma. I had the inside scoop with her as one of my good friends actually trained her in fellowship, and I know she's a phenomenal surgeon and doctor, and we're really excited to have her on the team. Myself, Dr. Nair, Dr. Castellano are the 3 LSU Health New Orleans gynecologic oncologists. Shauna Moran is our PA. She's been working with our team for a few months, but she has already helped make a tremendous forward progress. She's quickly become the heart and soul of our UMCNO service, and our patients get to know her and have really enjoyed the continuity and compassion that she brings to the table. She has a strong background in primary care and has filled in a lot of gaps for our patients who may have primary care needs while on treatment or survivorship. Other faces you may see in our clinic include our nurses. Claudia joined our team at LSU Healthcare Network and works with us at our Metairie and St. Charles offices. She's organized, kind, and smart. very excited about having her on the team. Junquel is our nurse navigator at UMCNO. She is one of the most get it done people I have ever met. She's a true gem and really dedicated to helping patients. Kristen is our fantastic surgical scheduler at the LSU Healthcare Network. Kristen Cordes is our LPN at WestJeff, and Lise Tabor works with us as well. And she's our CMA at LSU Healthcare Network and has been a real asset to the team. With a new cancer diagnosis, getting accurate idea of what exactly is going on is fundamental to doing the right things. We're in open communication with our pathologists and radiologists to help ensure we don't miss an opportunity to improve your care. The LSU Radiology Department actually has a fellowship in women's imaging, so have been extremely helpful, and the pathology department is also similarly extremely communicative and collaborative. Aggressive cancer care requires aggressive treatments. So we are very excited about some of the intensive care options that we have. So that basically means if we give you an intensive medical or surgical treatment to try to fix your cancer, if you need an ICU, for example, at UMCNO, they've got a fantastic ICU service. And that's really supported us in trying to be aggressive with your cancer. We've been very fortunate to have a very strong relationship with some of our collaborative surgical and procedural specialists. I will say our support by colorectal surgery, surgical oncology, urology, and interventional radiology has been extremely strong. And they've really helped us care for women with cancer in a very multidisciplinary fashion. Our radiation oncologists are wonderful. We work closely and communicate regularly with radiation oncologists throughout the state who are extremely talented. We've been particularly pleased with the LCMC team, especially Drs. Zachris Vincent and Dr. Harmon, who Dr. Zachris actually has a special interest in GYN cancers, and we communicate with her regularly. We work very closely with palliative care specialists, and LCMC has really invested in a phenomenal palliative care team at UMCNO, and they help you be clear about your wishes and goals no matter where in the cancer journey you are, and make sure that you're not suffering too much, and that we're adhering to your wishes. While we often do administer our own chemotherapy, we work very closely with some very talented medical oncologists in the community and at LSU. To LSU Healthcare Network, medical oncologists deserve special attention because of their specific interest in treating women's cancers. Dr. Agustin Garcia is a medical oncologist with a special interest and expertise in women's cancers. He trained at the University of Illinois and then University of Southern California. He served as a national leader in drug development for breast and ovarian cancers and is the section chief of hematologic oncology at LSU New Orleans. He's also the Charles W. McMillan III and Richard Paul Grace Chair in Cancer Research. He's a local and a national leader in women's cancer care and has been a tremendous asset as we build our section. Dr. Michelle Locke has been with LSU New Orleans since 2012, and she's a special interest in breast and gynecologic cancers, as well as health disparities in cancer care and minority clinical trial enrollment. She's involved in setting up a survivorship clinic at UMCNO and is very interested in quality of life and survivorship issues. And then finally, genetics is increasingly becoming an important part of what we do. Alex D'Angelo is an instructor and a master in genetic counseling who teaches our students, residents, and us all of the time. And she's extremely helpful in sorting out tricky genetic questions and valuable resources. So it's a huge team, and certainly this is not comprehensive, but I think we're very set up to successfully provide advanced cancer care. Next slide. So we see patients at 5 different hospitals. At UMCNO, we see patients and administer chemotherapy at the Cancer Center, and we have a busy surgical practice there, as well as at East Jefferson. And we see patients at the Metairie Multi-Specialty Clinic as well. Next slide. West Jeff has been a recent expansion, but is quite busy. Dr. Castellano will have a big footprint here. We've also opened clinics recently in the St. Charles Toro area to better serve the Garden District. We also service Children's Hospital when we have young girls who have needs that meet ours, which is hopefully not often. And then in Lafayette, there's a lot of cancer and no GYN oncologists at this time. We have 2 fantastic GYNs that we work with very closely out there to get the women in that region the cancer care they deserve, and you'll be hearing more about that in a second. All right, so we see women with cancers, as you've heard of the reproductive organs. We also treat women with complex GYN conditions. We help coordinate and plan complex obstetrical deliveries, such as with invasive placentas, as well as when other cancer specialists have issues that involve our organs, like colon cancer involving the ovary or things like that. We also help counsel and care for women with a genetic predisposition to cancer, and we treat women in Louisiana and beyond. So we know that women who participate on clinical trials have superior outcomes. They live longer and do better. However, only 5% of women with gynecologic cancers do this. The primary method or path for improving the treatment options for women with cancer is participating in these clinical trials. And participating in these trials does help others. If the women in our region participate, that means that the science that trial generates applies to the women in the region. So you're not just helping some abstract woman in some random part of the world, you're helping your neighbor or your daughter or whoever might in this region might get cancer in the future. But we never want you to feel pressured. We are excited to have these trials open and available because we always want the best options available for you. We have several trials open at UMCNO and at East Jefferson that cover ovarian, uterine, cervical cancer in the early and late settings. These trials really span the gamut from immunotherapies to stem cell treatments to targeted therapies, treatments for rare tumors, symptom control, and evaluating health disparities. If you want to learn more, you can visit our website too. The Steel Magnolias program. So as I discussed, we're really trying hard to get women in Lafayette taken care of. And there are a lot of women in this region of the state that do not have GYN cancer services. It's a big ask for to get them to come all the way to New Orleans to visit us regularly, especially in the surveillance setting. And traditionally, gynecologists remain involved in these women's cancer care. So we've set up, we've been lucky to have this relationship with two talented gynecologists in Lafayette, Dr. Holly Provost and Dr. May Thomasy, and Suzanne Vieter is their nurse navigator who's helping us coordinate this project. But most recently, to reduce the financial burden and the time burden that's required for them to come back and forth, we've developed this shared telehealth for multidisciplinary gynecologic cancer care survivorship program, where they actually go in and get the physical portions of their exams in their office. And then we telemedicine in, review imaging and labs and make recommendations sort of pertinent to their cancer specific care. One of Dr. Nair's large efforts has been to coordinate what I believe is likely the most comprehensive and well-run multidisciplinary tumor board in the state. Experts from a variety of backgrounds, such as medical oncology, radiation oncology, radiology, pathology, genetics, palliative medicine, OBGYN, and other surgical disciplines, and a variety of other sites, and not just LSU New Orleans, but our colleagues in Baton Rouge and Shreveport regularly join in. They meet twice a month to discuss complex cases. This promotes high quality evidence-based care, which translate directly to improved treatment and outcomes. We know that our patients are getting top-notch care because of this process, and we believe it is helping to elevate cancer care throughout the region. Another exciting thing we did recently in collaboration with our surgical oncology colleagues is the first HIPEC case for ovarian cancer in New Orleans. This is HIPEC is hot chemotherapy, where you perform surgery to remove ovarian cancer, and then you instill heated chemotherapy into the abdomen and pelvis. Data continues to come out to suggest that this is actually a really important thing that we can do to improve ovarian cancer survival, and so we're really excited to offer it in New Orleans. Education is a huge part of what we do, and we're very proud of our efforts here. The LSU OBGYN residents are a tremendously devoted and hardworking group of young doctors, and it's a great pleasure to help them grow and become the next generation of OBGYNs that serve the women of our state. Our medical students rotate with us regularly, and we work with them closely in clinical settings, as well as in designing and executing research projects. We have a really great group of medical students who collaborate to perform research projects and stay on track, called the Women's Health Research Consortium, and this has resulted in an increase of research projects and publications. We're dedicated to educating each other. I learn from my partners every day. Dr. Nair teaches me things all the time, and I'm very excited to have Dr. Castellano join us because I think fresh blood is a good thing. Dr. Nair's tumor board, as well as a regional journal club that she makes happen a few times a year, where we meet and discuss articles with our colleagues, even at competing institutions, really help keep us all fresh. All right, next slide. If you want to get involved, please visit our website. We have information about how to get involved and who to contact. You can follow us on social media. We're on Twitter, Facebook, and Instagram. And yes, we do have a fund, and we use the money from that fund to help women with cancer in critical ways when money might be an issue, as well as to support the educational mission of our section. And then, next slide. And finally, just a little plug, there is a race to end women's cancer, which usually happens in person, but this year is obviously going to be virtual. If you're interested, it's called Move for Her. You can register for it online at foundationforwomenscancer.org or moveforher.org, and it's going to be on October 18th.
Okay, great. Thank you so much, Dr. Jernigan and everyone. We are happy to present 3 patients who have graciously agreed to tell us a little bit about their experiences. And we do have a small change in our program today. We will be hearing from one patient's daughter, Lynn Naquin. Her daughter, Jamie Moulton, will be joining us in her place today to tell us a little bit about her story. And today is Jamie's birthday. Happy birthday, Jamie. Thank you for being here.
Thanks. Appreciate that. I start now? Okay. Okay, so my name is Jamie Moulton. I am Lynn Naquin's daughter. She is a 69-year-old cancer survivor, ovarian cancer survivor. She wrote down this speech, so I'm just going to read it exactly how she wrote it. The diagnosis. While taking a shower one day, I felt a lump on my partial hysterectomy scar. I mentioned the lump to my doctor, and she ordered a CAT scan. The scan was done on February 15th, 2019. When she pulled up the scan on her computer, my husband and I saw 2 large black holes. She explained that I had 2 ovarian cancer tumors on my ovaries. When she recommended an oncologist. The following week, with my husband and my 2 daughters by my side, we saw Dr. Nair. She ordered more scans and a biopsy. She explained that I had stage 3 high-grade serous ovarian cancer. At that moment, I thought I was handed a death sentence. We were all in shock. I would need 3 to 4 rounds of chemo, followed by a very extensive surgery to remove all the cancer involved, and 3 more rounds of chemo, then more scans to determine if the cancer was gone. When Dr. Nair told me of the extensive surgery and what my body would go through, I thought I would pass out from being so afraid of the life I had with my family. I was afraid of dying too early. Sorry, I get a little emotional.
Hey, Jamie.
Take your time, Jamie. This is hard. We appreciate you doing this.
Okay. All right, sorry. I still had a lot to live for. My family and friends encouraged me to be strong. In the beginning, I have to say, I was depressed and frightened of the unknown. My determination to live grew every day. I believed in my doctors and followed instructions to the T. I won't deny there were many nights of crying with my husband in the middle of the night when the darkness surrounded us. But with the grace of God, I got through it, and my courage and strength to fight, it became greater every day. Goodness gracious. Sorry, y'all. The chemo. As the months went by during chemo, my attitude changed. My family and friends were with me every step of the way during my treatments. I always had friends and family with me holding my hand and giving words of encouragement. I think those gestures helped me get through, and my confidence grew. As I looked around the infusion center, I definitely knew that I was one of the lucky ones. I truly believe that being positive going into any chronic illness helps. I put all my thoughts into living, not dying. The nurses and staffs encouraged me to be positive and take it one day at a time. I encouraged other patients and talked with them so we would get the chemo treatment out of our minds while the poison was going through our body. We shared stories and cried and laughed together just to get through one more treatment. It surely helped knowing that I wasn't alone during this process. The surgery. The surgery was scheduled for July 17th, 2019. I had grown positive during the months of chemo but was scared to death at the same time. I don't think anyone can be prepared for the extensive surgery I had. I'm a very active person who likes to stay busy all the time. Well, needless to say, the surgery put a big stop to that. The surgery was 8.5 hours long. I knew before I went in, my family was terrified too. I hated putting them through all my pain. I was sent to the ICU for 3 days, which were a blur. I learned that the cancer was much more extensive than originally thought. Dr. Nair removed all the affected organs, and Dr. Selinsky resected my colon where the cancer had invaded. Also, in the process, I lost my spleen. I had an ileostomy to take care of, which, by the way, grossed me out. but I knew that I would live, and that made everything okay. It was a painful recovery that really took a lot of caring for my husband and my family. Caring for by my husband and family. I felt so dependent on everyone, which was very hard for me as I am a very independent person. I had to hand over my care of the ileostomy to my husband and felt so guilty for doing so. I have to say, I could not have done it without him. I got my strength through him. Whew. He was strong, and I knew I had to be strong too and give up my independence, if only for a little while, to recover. After 3 months, I started to regain my strength and confidence again. After 6 months, I knew I was NED, no evidence of disease, and that made my whole world change that I had been living in for that 9 months of diagnosis, chemo, surgery, and more chemo. I know I will always have the chance of ovarian cancer returning, but staying positive and following all my doctor's instructions, I know I will make it through. I encourage all cancer patients to be as positive as they can be, to be able to accept change, and the hardest of all for me, being receptive to accepting help by my family and friends. My life after ovarian cancer. I'm an advocate for OCRA, Ovarian Cancer Research Alliance, and speak of my journey through survivors, teaching students at LSU Medical School, and speak at seminars. I host on the symptoms of ovarian cancer. While we are experiencing COVID-19 quarantine, I devote my time to making masks with $1 of the proceed on each mask donated to LSU Health Service Gynecologic Fund, raising over $1,300 for disadvantaged women with ovarian cancer. That's all.
Thank you very much, Jamie. We really appreciate you sharing your story, or sharing your mom's story. And I know that was hard. We really appreciate it. Thank you. Next up, we have another patient. Her name is Britnie Walker, and she'll be talking about her complicated situation with ovarian cancer and what her days in treatment. Oh, I'm sorry. Britnie Walker with a rare uterine cancer and going into an unplanned surgery over the weekend. And oh, we got you? Okay.
Hi, how are you? I'm Britnie Walker. I am a 35-year-old survivor of a very rare uterine cancer.
Britnie, I'm sorry to interrupt you, but we don't have your video.
Uh-oh.
There you go. Thanks.
Awesome. Hi, it's me again. So for 14 years, I had an irregular cycle. But in early 2019, February, I got a cycle for 2 weeks. I didn't think anything of it because I hadn't had one for years before. So I just figured, hey, it was just kind of playing off of that. Well, I got another cycle again in March. This one didn't stop until February 14th, which is the day of my surgery. But in that time span, I went through 4 to maybe 5 biopsies, 4 blood transfusions. So at that point, we knew it was something really serious, but we just couldn't figure out what it was. So there was no game plan. One Friday, I went to the ER and I was admitted because the bleeding had become uncontrollable. The very next day, I was forced to have emergency surgery. There was no time to prepare my family, my kids, my friends, or even myself for the journey I had to come. There was no time to have talks with Dr. Nair that I wanted to have, like freezing my eggs if I wanted to have more kids. I'm not married. My husband may want to have kids in the future. Who knows? But I didn't have the time to have those talks with her. Sorry. On the day of the surgery, when she entered the room, all I heard was, "It's time. At this time, we're going to take your womanhood." No, that's not what she said, but in my mind, that's what I heard. because I'm sorry, give me a second.
Thank you so much, Britnie, for doing this. This is so hard to share your story, and it's such a personal story. So I just want to take a second to thank you and thank all of you for being a part of this.
Okay. I simply wasn't ready. But I do thank God for the people he placed in my life. My support team was amazing. Dr. Nair's team was absolutely amazing. They went above and beyond for my care, not only physically, but mentally as well. My friends and family played a huge role in me being here today. My niece was 18 at the time. She gave up 6 months out of her life to take care of me. She grew up in the blink of an eye, having to empty and clean my nephrostomy bag, having to take me back and forth to treatments and to hospitals and to doctor's visits. It was a lot on an 18-year-old, but she was willing to stop the world in a moment for me. And I'm truly grateful for having her. It was the strength that she had that got me through it. I experienced every side effect you could think of, from not just the loss of hair, but ringing in my ears, which caused me to have a little bit of permanent hearing loss, a blockage in my kidney, just to name a few of them. But through it all, I remain positive. This is as much as a mental battle as it is a physical battle. So keep hope. Support your loved ones even when they seem strong, because they need it. I know I did. My family became my strength. It was having them by my side that helped me to stay positive and get through it. Leaning and depending on others, on one another, got us through from day to day. So if you guys ever have the opportunity to be the person someone needs to lean on, be there. I know I will. And moving forward, I am definitely becoming more involved with my community as far as education on the type of cancer I have. As I learn, I educate my family, my friends, and whoever wants to listen. So I'm not going to hold you guys much longer. I just want to say thank you to everyone who was involved in my care and everyone who is where I once was. Stay strong. And if you just need an ear, I'm always here. Thank you, guys.
Thank you so much, Britnie. Thank you for sharing your story. Next up, we'll be hearing from Jillian Borges. And Jillian is going to talk about the situation that she is now dealing with ovarian cancer and what her days in treatment are like. Welcome, Jillian.
Hello, everyone. Can y'all hear me okay?
Yes.
Okay, great. I had to go ahead and write everything down because, of course, I'm going through chemo, so I have a little bit of a disoriented brain right now. So I just wrote everything down. So I'm going to go ahead and just share my story right now. Hello, everyone. I'm Jillian. I'm 38 years old. This July of 2020, I was diagnosed with ovarian cancer, stage 1B. I had the surgery and the cancer was contained in both of my ovaries. In addition, they found endometriosis in my uterus, fallopian tubes, and I had a full hysterectomy, as well as the removal of lymph nodes and my appendix. So now I can go ahead and back up and tell y'all how all this came about. I work about 40-hour weeks most of my life since I was about 15, sometimes 2 jobs at a time. So I really could honestly say that a lot of painful symptoms that I may have been having was just another long, hard day at work. Some symptoms could include lower back pain, constant foot pain, fatigue, sudden weight loss. I never really would have thought, oh God, that has to be cancer, So I guess it all caught up to me late November of last year, 2019. I had a spur of the moment ER visit due to some sharp pelvic pain I was having on my right side, accompanied by some pinkish type looking rash that was traveling all the way down my leg. They mainly focused on doing just an ultrasound of the leg. They just pretty much assumed that the pelvic pain could have just been related to some nerve. They diagnosed me with superficial thrombosis, which was clotting of the blood in the superficial vein. So they discharged me, told me to take some over-the-counter low-dose Bayer aspirin, ibuprofen for some inflammation as needed, wear compression socks, to work every day and continue on your life, and everything should be just fine. So we can fast forward a bit. 6 months goes by. It's now May 2020, COVID-19 at its all-time hype. One of my jobs closed temporarily and the other job remained open. So I figured I'd go ahead and help them part-time to get through COVID. And then I, of course, start experiencing that sharp pain again, only this time it was on the left side. I did have a small pinkish type looking rash that popped up on the inner side of my left knee. And I said, here we go again, must be that blood clot. I decided to go ahead and get a consultation with my gynecologist to figure maybe she would have a better opinion of all this. She performed a vaginal ultrasound, which would lead to a mass located on the left side, and later a pelvic MRI would discover the even large tumor-like mass was on the right side as well. I was referred to Dr. Jernigan, then a gynecological oncologist, to talk about surgery options. And we talked a bunch leading up to how everything happened. And she scheduled a surgery date for me. Most importantly, she did want to talk about scheduling a CT chest scan as well. She just wanted to make sure that nothing was spreading upward. She said mainly just a precaution. And I said, sure, let's go ahead and do that. And I'm so glad that she did. The results of the CT scan came back a week before my surgery, showing that I had a pulmonary embolism. What that means is that it's blood clotting in a deep vein that I didn't even know that I had. The clot had broken from the vein, traveled upward, attaching to my lung, and then I was rushed to UCMC's emergency room for an immediate IV blood thinner, and a small procedure was done where they placed a filter in my chest to block any further clots from spreading to my lungs or brain. As traumatizing as all that sounds, I had a successful surgery and feel very blessed that they were able to catch everything just in time. It was suggested that I undergo 3 treatments of chemotherapy just to go ahead and help kill any microscopic cells that were lingering in my body. And my first treatment was August 11th. Some days I felt extremely fatigued. Other days it was hard to get up and walk around due to weak, shaky knees, just feeling like I wouldn't be able to hold myself up to get around. It was pretty scary. It's not the kind of person that I am. I'm usually up and about like a crazy freaking woman. 2 weeks later, I lost my hair. No matter how bad I felt, I could get through it, and tomorrow would be a little bit better than the day before. And it was. September 1st, I had my second treatment, and I'm doing pretty well with it. Only one more treatment to go. Just got to take it one day at a time. And then all I can really do at this point is to stay positive, heal, and progress. And now, more importantly, I do want to help raise awareness for others that are suffering and to learn more about this crazy cancer, most commonly known as the silent killer. And just wanted to go ahead and thank everyone for letting me join this seminar, and for everyone in the medical field. Thank you so much for what y'all do. And that's it. Thank you so much.
Thank you, Jillian. And thank you to Lynn through Jamie, Britnie, and Jillian. Thank you all for sharing your powerful stories today. And I know it helps our audience to hear those, to hear your personal point of view. We're going to start taking questions from the audience. So now y'all can start typing in, and we're getting some really nice comments in the chat if y'all want to read them. They're really nice. And also, all of the chats will be recorded because the webinar is being recorded, and every question and all of the answers will be recorded too for you all, and the links. So we can take questions from the audience if you have them now.
I'll ask a question if that's okay. And I'll target it to any of y'all, but maybe Jillian, because you're going through this right now. Can you give us some tips and tricks of how you help get through each chemo cycle? We know that's hard, and what strategies to use to help make it more manageable?
To be honest, I went into it thinking that it was going to be the worst thing ever. And after, you know, having the IV put in, and then they come in and they check on you, and I kind of was just like, you know, this really isn't the worst. This, you know, I've had a couple of oral surgeries done in the past. I've had some teeth pulled. I've been under and had to come back to and get through some really painful experiences and things like that. So I just kept saying to myself, like, no matter what, you got this, you can do this. I had a huge support team. I have a lot of people following me, pushing me to get better, because they know what kind of a person that I am, and that I am not really a lazy bone anyway. So just to be able to, you know, stay strong and really take it slow, you know, like things aren't going to be exactly how you want them to be. And you know, your body is like feeling super weak, and that's, you know, might not be the kind of person that you are, but don't overly push, you know, and just stay strong and really just kind of, you know, battle it, fight it out. And I also love art and really never had a lot of time because of work to really get inspired. So I really took a lot of time with taking it easy and forcing myself to just kind of sit at a table. And then I started doodling, I started drawing a lot, I started painting. I learned a lot more about watercolor. Didn't even realize that I could be so good at it. So I dabbled on art as much as I could. And now I'm actually making prints of my art, and hope that I could start raising a little bit of money to go towards any kind of charity that I can, with helping you guys with research and everything. So that's basically it.
Thank you, Jillian, and I can't wait to see some of your artwork.
Yeah, absolutely.
There was a question in the chat. Dr. Jernigan, do you want to take this? Who should receive the HPV vaccine? What age group, and what age is too late?
That's a great question. You know, it's really fantastic that we have a vaccine that can prevent cervical cancer. We really shouldn't be a disease that we see anymore. It used to be up to age 26 could get it, and that and it's still the case that we target children around roughly the ages 9 to 11 if we can. But really, everyone can get this now. It's FDA approved up to the age of 45. It prevents cervical cancer, cancer of the anus, cancer of the throat, cancer of the penis. Like, basically, lots of cancers are prevented by getting this vaccine. And if women have had pre-cervix cancer lesions, actually getting the vaccine seems to reduce the recurrence of that lesion. So I would highly recommend it for anyone up to the age of 45, really.
And like Dr. Jernigan said, it's approved not just for women, but men and women, and boys and girls. It's the HPV vaccine. The company that makes it in America is called Gardasil.
I have a question for the survivors, well, Jillian, it's more plans for you, but for everyone else's, what did you do? What kinds of things did you or do you do to celebrate being, or you plan to do to celebrate being done treatment?
My family and I, we really like to cook. So during treatment, I didn't have an appetite, so I didn't really cook much. We didn't really cook much as a family. So once I finished treatment, literally on my last day of treatment, we piled up at the house and we broke out the grill, the boilers. We cooked inside, outside. We had food for weeks. And I couldn't have very many people around because it was my last day of treatment. So it was kind of like a drive-by. Just, we cooked all that food and people just kind of came by real quickly, grabbed something to eat and kept going. But my family and I, we celebrate all my milestones. It's coming up on the anniversary of my big surgery. So we're planning to do a little dinner on that night as well. My family, we revolve around food. We're definitely a house full of unprofessional chefs. So we're definitely planning to do another cookout for the anniversary of my surgery.
This is Lynn Naquin. May I add a thank you to my daughter for telling my story. And my husband, for my cancerversary, which will be next week, September 17th, we're going to go to the beach and light lanterns, let them fly up to show that it's gone, not going to happen anymore. And I hope it'll never come back with the help of these wonderful people that keep me alive. Thanks to both of you all.
Thank you for the work that you do, Lynn, and thank you for being a part of this today.
If anybody wants any information on how they can help any other cancer victims, please contact me. Please email me, Facebook me. I will be more than happy to talk to you or to tell you how to get involved being an advocate for OCRA. Thank you.
Thank you. We do have some more questions. Someone is asking, where can I find good information on, I think you called it BRCA research, BRCA?
Yeah.
My favorite website to just refer people to for information is the Foundation for Women's Cancer. I think it's a really safe starting point. There's a lot of crazy stuff on the internet, but I would just say if you Google Foundation for Women's Cancer, they'll take you right to their website and they'll have all kinds of information about things like BRCA.
And Betty, just to add to what Dr. Jernigan said, there are actually a couple of really great peer support groups on Facebook for women with BRCA, and I've actually been involved with some of them that I can share with you in doing research through these Facebook groups for targeting women with BRCA. So that's another great resource. Dr. Castellano, do you want to take this one? Do you have an outreach for women who do not have access to care due to lack of insurance, and where we see those patients?
You know, being new here, but being familiar with the system, you know, we see patients independent of insurance status and have different programs, mainly through our UNC campus. But when I chose somewhere to practice, I trained specifically in a state with underserved populations. It's really important to me to work in a place where we can offer not just the standard of care, but excellence in care. So that means access to enrollment in clinical trials. So women who may not have funding may still have access to cutting edge medicine, whether they want to or not, completely voluntary. But we do feel like those are the best outcomes and the best options for patients. So we do have many mechanisms in place and resources, not just the oncologists, but PAs and navigators and research assistants, a whole team of people to help get people through the care, whether it's the initial surgery or chemotherapy or survivorship, because there's a lot of needs that patients come up after cancer diagnosis and after treatment. So we really strive that if we find places where we need to improve that, to be the leaders and set up those resources and identify the needs in our community.
Okay, we have more questions. How do you make screening more accessible and affordable? I know that diagnostics exams are expensive. I share a similar story of having abdominal pain, being dismissed, and as a nurse having the autonomy to seek out other providers. Found that it was a bleeding hemorrhagic cyst. How can we ensure that vulnerable populations, women of color, poverty, know about and screening frequently?
Yes, that's a great question, Deborah. Thanks, Sam. So one of the things that we're trying to do is do things like what we're doing right now, is make people aware of what is normal and not normal, and empower the general population of women to seek out care, even if they get dismissed by the first person that they saw. And Jillian can probably speak to a little bit of this because she shared part of this in her story. But being very aware of your symptoms, keeping track of them over time, maybe even using the CDC symptom diary is a helpful little tool so that you can have a really accurate idea of what's been going on symptom-wise. And then if you know something is wrong and you're getting dismissed, then go see another doctor, and that's okay.
I think another important job as a subspecialist is not just to teach patients and general community outreach like this, but Dr. Jernigan and Dr. Nair are taking a lot of effort to teach the physicians that see patients in primary care settings and make those symptoms, alert symptoms. Abnormal bleeding isn't normal ever after menopause, and that should always prompt workups, and abnormal pap smears and how to manage those, and to advocate for vaccines. So that's part of our job as subspecialists, is not just to educate patients, but educate the other doctors taking care of our patients, and nurses and nurse practitioners. So it's a whole team.
Yeah, just to echo with what both Dr. Nair and Dr. Castellano just said, and I have a theory about our patients. A lot of our cancers, our big cancers, hit women primarily in their 40s to 60s. I mean, that's really our age range where we see most of our cancer. And I think part of that is that is women are at a really vulnerable point in their lives in that age range. They're taking care of kids, they're taking care of parents, they're the primary caregivers. So they have a little bleeding. I hear the story over and over again. I had a little bleeding and spotting, but then, I was busy taking care of my mom and she's in a home, or she's got Alzheimer's. And I was busy taking care of my kid who just moved back home from college and couldn't get a job because of the economy and coronavirus. Or, I'm homeschooling my kids in the middle of this crazy pandemic. And so I just didn't go to the doctor because there's too much on my plate right now. So it's really important to advocate for yourself, but it's also important that we as doctors try to dig a little bit when you tell us something's wrong.
From a patient standpoint, stay on it, because the doctor I saw before I got to Dr. Nair, she assured me that I didn't have cancer. She said, her words verbatim is, "It's not a cancer. I just think it's old blood because you're having a regular cycle. We'll probably do a DNC, but I'll send you to a specialist just to make sure." And she was wrong. If I had went home and listened to her, I wouldn't be here talking to you guys now. So just stay adamant. As women, we know our bodies. Just pay attention to the signs and the symptoms. And if anything feels like it's abnormal, then definitely don't let somebody dismiss you, because nobody knows you the way you do.
Thank you so much, Britnie. And there's a question for our survivors from Laura. What have you learned along the way that you wish you had known before? And you kind of just spoke to some of it. And what do you tell your family friends when trying to educate them on your cancer?
Dr. Nair educated me a lot along the way. I asked for pamphlets on every single thing that we did. So I have this huge box that I have in my room. So whenever someone asks me, I'll pull out those pamphlets and I just kind of go through it with them and just kind of say, hey, this is where it begins. And I'm big on research. I Google a lot. I do a lot of research. So I do go over it, because my mom she had no idea. She would come to every appointment with me, and then when Dr. Nair would leave the room, she would ask, "What does that mean?" So I would have to kind of break it down for her in layman's terms. But just research is like the most important part for me and my family. I just kind of went over everything that I learned. Once I was educated, then I did a little bit more so that I could be able to explain it in a way that didn't have so many big words or so many medical terms, because we're not all familiar with the acronyms and all that jargon that you get when you go to your appointment. So just knowing what they mean truly helps out a whole lot.
Okay, everyone, we've reached the 1 o'clock mark, so we can only take just a couple more questions. If you have them, please post now, because we do need to wrap up. And I do have a question that someone posted. Actually, Lynn posted this. What are some of the lasting effects that these cancers can have on your life?
You begin to value things a lot more. You learn a lot about yourself. I've never been a very superficial person, but losing my hair, as crazy as this may sound, is one of the biggest things. It's one of the biggest parts of my journey, was losing my hair, because here I am in my 30s and I've just had a complete hysterectomy. And then for my hair to fall out, it made me feel like I wasn't feminine enough. But through the support of my friends and family, they assured me how beautiful I was and things like that, which is really crazy because, like I said before, I've never been a superficial person. It's never been based on my looks or the looks of anyone. But for me, that played a huge role. So just kind of valuing things more, and you tend to look at things in a different light.
Yeah, I could add just a little bit to that. I agree with everything that she just said. Also, the way that I look at things too is just paying it forward, just getting all the knowledge that you can, just to be able to help somebody else, come up and not struggle as hard, or, just the type of people that we are is always wanting to lend a helping hand and do things for others. And then all of a sudden something turns around and slaps you in the face. And now you have all these supporters trying to help you out because, you're paying it forward. So I just wanted to add, that's kind of how I feel. Just always wanting to put that next foot forward, and, no matter what, we got this, and we're all going to, do it together.
Yeah, it's definitely humbling.
Yeah, for sure.
Okay, we did get one more question. Jamie, as a family member, what did you feel your mom's doctors did well to educate you and your family, and what do you wish we could have done better?
Y'all gonna make me cry again, aren't you? As a family member, I learned a whole lot of things that I didn't know that I should have been doing myself. As y'all know, it's my birthday. I made 45 today, and evidently there was a lot more things that I should have been doing, looking out for myself to see, and my sexual organs or whatnot, I don't know what you call it, that I wasn't doing before, that now I need to start looking out. And then my daughter, who's behind me, who is 20, also needs to be looking out for herself. So it's kind of, and my son, who's 16, it just kind of, it's like the domino effect. Everybody in our family now is keeping our eye out and being more careful and watching out for Mom, who I'm sure y'all heard her talking, but now she's in the hospital again because she's sick with something else, but we're all here to take care of her. So we're just a much tighter knit family right now because of everything that's happened.
Thank you, Jamie, for being a part of this and being so flexible in the last minute. We really appreciate having you here. And as we wrap this up, I just want to say a special thank you to Lynn, Jamie, Jillian, and Britnie for sharing your stories. I think that was so much more powerful than anything any of the three of us could have done. So thank you so much for doing that. And to close us out, we have Catherine from the LSU Health Foundation who's just going to wrap this up.
Yes, thank you. I mean, just to echo everything that you've said, Dr. Nair, and what I'm seeing in the chats, this has been such a powerful presentation. So thank you all for your hard work and effort to pull together and to open up your hearts to share such moving stories. My role here at the foundation as the Director of Development is to help to grow resources and raise awareness for these incredible programs that we offer at LSU Health. So you'll probably see I dropped a couple of links in the chat area, so you can get involved, follow us on social media, as well as support us, whether you'd like to get involved with volunteering, to give a gift. It's all in there. And you could also feel free to reach out directly. I'll include my contact information. So again, Britnie, Jillian, Jamie, Lynn, it's just incredible to hear your stories, and we appreciate your bravery for doing so. So thank you.
All right, everyone. Thank you. Take care.
Bye. Thank you guys for having me.
Thank you.
Thanks so much.
Bye.
Bye.